Hi, folks. This is Dr. Brent. Welcome to week 6. I just wanted to quickly go over the 3 assignments that you have due for this coming week. And of course, the first one I want to go over is what is really the largest assignment in this class, and that is the Circles of Sexuality's paper. As you know, we went over the model, the Circles of Sexuality, in week 1 and have actually used this model as the primary format and structure for this course. And so basically what I'm asking you to do is to look at each particular circle and present an opportunity to look at different concepts under that circle, use an APA Level 2 heading, and discuss your own personal sexual development in that specific area. Here's a great example, and that should be about 1 page. Under the circle of intimacy, you may discuss the concept of trust and how that was impacted in a personal relationship where you experienced perhaps pain, hardship, joy, or growth. Example, maybe you were dumped by a romantic partner, maybe you felt supported by your family in a tough time, maybe you encountered surprising support from your boss, etc. Describe that experience and then flesh it out. Just a comment, whenever asking students to reflect on their personal lived experience, especially around human sexuality within the context of the circles, which remember, the Circles of Sexuality really highlights that sexuality isn't just about what you do with your genitals or sexual behavior or sexual expression in that way. It covers sensuality, body, touch, feel. It covers intimacy, interpersonal connectedness. It covers sexual identity. Who am I as a sexual being? It covers the blue light special, sexual health and reproduction, and it covers sexualization, how we use our sexuality. So I want you to really think a little bit about a particular life experience that you feel like you can explore in some depth in 1 page and kind of describe it a little bit. If you feel like there's something that you don't want to share, you certainly don't have to. I would encourage you, if you feel like there's an area in your own history where you feel uncomfortable or experience pain or even trauma, yes, social workers, as we know, have trauma, then I would encourage you to do your own personal work on it, either through personal reflection, journaling, or seeking counseling and or therapy in order for you to be able to try and address that so that if and when, because this will happen, clients present with issues that are comparable and similar to your own, that you have done your own homework to try to really help resolve those things, and certainly seek supervision, continuing education, look in the literature, explore best practices, examine practice wisdom from mentors, etc., etc. And always, at the end of the day, come back to what's in the best interest of my client. And that brings us, of course, to the practice implications example. If your life experience example is 1 page, your practice implication example is 1 page. And it can involve direct practice, supervision, discuss how your experience of trust, if we're going to stay with that example, influences your relationships with clients, how you interpret their trust-based experiences, how you design interventions. You may also discuss how you might use supervision around this issue. Be very explicit in that discussion. As I mentioned before, when you talk about using supervision, be very explicit how you're going to use it, what questions you're going to ask, what kinds of research might you pull into it. So that's an important area. So that's going to be basically 2 pages per circle, 1 for each circle, okay? And then we're asking you to include a 1-page addendum that describes what you learned from doing this assignment personally, not necessarily professionally. I know personal and professional values are intermingled, and I really want you to explore what did you learn from doing this assignment personally. All right, so it should be about a total of 11 pages, okay? All right, and it is, again, APA. Please read through all aspects of the syllabus in relation to this assignment. If you have any questions, feel free to email me. All right, now let's go to the 2 remaining discussion topics for this week. Discussion 6 is T is consent. As you can see from the video on the front page, I want you to watch the movie Tea is Consent. It's very short. Please note that it does in fact have some profanity, so watch where you watch it. And then read the article Consent, It's a Piece of Cake. And then kind of highlight and describe reasons why you agree or disagree with the author, Kathy Young, the person who wrote this article. And in about 8 to 10 sentences, define consent in your own words in about 4 to 5 sentences, and then describe potential confounding factors for how consent may be misinterpreted in sexual encounters. And then for your response, do you agree or disagree with the interpretation of your peers' reading of the article Consent, It's a Piece of Cake? Do you agree or disagree with their definition of consent? What are some of your reasons for this? And reflect on their cited confounding factors that they discussed here. Do you agree, disagree, and what are the implications? This is probably one of the most important components of this particular discussion, thinking a little bit about the implications of what are some of the confounding factors. One example somebody might be is, what if somebody says no and somebody doesn't listen? What if somebody doesn't say no but shakes their head no? Those kinds of things. So tease that out a little bit. I also respect that when talking about sexualization, specifically around how people use their sexuality, in this case for negative intent, with regard to violating someone's consent in relation to things like sexual assault, rape, sexual exploitation, sexual harassment, things of that nature, that it's sensitive for people. So please care for yourself during this process. Okay. And the last discussion is BDSM 101, is kink normal? So I'd like for you to watch the 2 videos, BDSM 101 and BDSM Dungeon Tour. Just as an FYI, you might be cautious about where you watch these. While they are, I would consider them not safe for work because of the content. They are not sexually explicit in nature, but they do have sexually explicit conversations. So read through all of these aspects in terms of DSM-5 criteria, and then how we go about framing that within the context of a strengths-based and or sex-positive perspective, how we determine whether or not something is healthy or whether something is harmful, if it's causing distress, if it's not causing distress, if it's harming to someone else or other, or if it's the only way someone can encounter sexual stimuli. Those are important variables here. So, and then read through this scenario and answer these questions in 8 to 10 sentences. Describe the necessary factors that would be required to help your client navigate a consensual BDSM encounter using the tools discussed in both the videos, and you must cite both videos, please. Identify at least 2 potential concerns you may have about those encounters and 2 potential positive outcomes you may have about them. And to your peers in the response prompt, discuss whether you agree or disagree with the concerns they noted and why, and how the strengths-based lens might illuminate positive outcomes discussed in your classmates' post. So again, whenever talking about bondage, discipline, sadomasochism, some folks may have read and explored and studied this stuff before. For some folks, this may be brand new. Please take your time with these and respond thoughtfully in accordance with our consistent etiquette that you have used throughout this course. All right, thanks so much, folks. If you have any questions, feel free to email me, and talk to you later. Bye-bye.